ahead and get started. Good morning, everyone, and welcome to our Urban Food Policy Forum. I'm Craig Willingham. I'm the Managing Director of the CUNY Urban Food Policy Institute, and I'm thrilled to be with you here today to have what promises to be an inspiring and thought-provoking conversation. Today, we're diving into Professor Kevin Morgan's book, Serving the Public, The Good Food Revolution in Schools, Hospitals, and Prisons. And we've brought together an incredible panel of speakers who are truly at the forefront of this movement. First, we have the book's author, Professor Kevin Morgan from Cardiff University, whose groundbreaking book on sustainable food procurement is reshaping how we think about the power of purchase in public institutions. Next, we're joined by Chloë Waterman from Friends of the Earth, a policy leader pushing for climate-friendly and equitable food systems. And finally, we have Nancy Cohn, a passionate voice and advocate for healthy food and equity with years of experience driving transformational change across sectors. You can read more about each of these speakers by accessing the link to their bios, and you can find that in the chat. So before we go any further, I'd also like to mention that we have several upcoming events. Rosita, if you could forward the slide, please. The first is Book Talk, The Painful Truth About Hunger in America, on March 27th from 10:30 a.m. to 12 p.m. Eastern Time. It should also be a very interesting discussion about where we stand in terms of hunger and food insecurity in the United States. And the next event is a Grand Rounds lecture we have by Dr. Omni Cassidy, and that will be May 1st, 2025 from 4 p.m. to 5:30 p.m. The CUNY Urban Food Policy Institute is housed here at the CUNY Graduate School of Public Health and Health Policy, for those of you who don't know. And we regularly have grand round discussions that are open to the public. And we hope that you'll take some time to look at the schedule of events for those on the SPH website and be able to attend some of those great talks. So now I want to turn it over to Kevin to begin today's discussion and for us to hear more about his book. Kevin?
Thanks, Craig. Can you see my slides, Craig?
Yes, you can go to full screen. There you go.
Okay. Okay. Well, many thanks to CUNY for hosting today's discussion, and many thanks to you all on the call for making the time to join us as well. What I'm going to try to do in the next 15 minutes is really try to do three things. I'd like to set the context for the book, when and where it began, as it were. Secondly, run very, very briefly through some of the key themes and arguments in the book. And then finally, try to distill some of the implications of the book for the food movement, or the good food movement, as I've called it, in the US and the UK. And then we open it up to the panel and to everyone on the call. So hopefully the slides will work and we can move on. So in terms of the origins of this work on what I call public food provisioning, it began around the year 2000 when we got invited to engage with a local project called the Powys Food Links Project. Powys is a county, a rural county in mid Wales. And the project, which consisted of health professionals, civic society people, municipalities, they had the unpretentious aim of trying to get local food into a local hospital, and it failed. It failed at every turn, and while it was a total failure, like all failures, it carried some useful, very useful lessons, and that turned out to be the subject of my very first report, the very first food report that I was personally involved with. And we tried to understand the reasons for this failure, because although it was a local project, it clearly had global resonance. And it was an unfunded project, a labour of love, as we called it, which was unfunded, but we felt was intrinsically significant. And therefore, we spent over a year trying to understand the causes of failure. And the causes of failure are here: perceived European Union procurement regulations. I say perceived because they were more apparent than real. Tendering procedures which were far too complex for small local suppliers. Public catering preferences that favored large suppliers, large corporates, because it reduced transaction costs. And then, most surprising of all to me as a rookie in this field, was the fact that the National Health Service auditing conventions had great difficulty accounting for the health gains of nutritious food. And with the exception of the first point, the EU regulations, which, because the UK, as you will know, is no longer a member of the European Union, sadly, uh, all the other problems are still alive and well in the United Kingdom, and I try to document these problems in the book. So I just wanted to highlight this first report because it shows how slow change can be and how vested interests have a very strong, cast a strong shadow over the entire field of sustainable public food provisioning. So that's the background of the work, which began, as I say, over 20 years ago. Moving on to the book very quickly, the premise is very simple: that the social significance of public food provisioning, what I call the public plate for shorthand, which is more than public procurement, by the way, but the social significance of the public plate is so much greater than its economic value would suggest, because public food provisioning is a small niche, as we know, in the overall grocery market. And the reason why it's so significant is because of the special nature of the beneficiaries. While the people in my book, the pupils, the patients, the prisoners, are all radically different groups of people, they all have one thing in common: they are highly vulnerable people in need of a nutritious diet. That's what makes them so special from a public policy point of view. So, very quickly, moving to the themes and arguments of the book. In part one, I take an international perspective to explore what I call the agri-food polycrisis. The polycrisis, as we know, is a term that's often used nowadays to capture multiple but interconnected crises where the sum of the parts is so much greater. And I argue that the agri-food polycrisis, in the case of the agri-food system, really refers to the interlinked crises of climate change, biodiversity loss, and the epidemic of diet-related diseases, which I'll come back to in a moment. And the broad argument at an international level, looking at global trends as well as European trends, I try to argue that reclaiming the public plate means using the power of purchase, public procurement, which is integrated with policies for production and consumption, that together these can fashion a fairer, healthier, and more sustainable food system. If they can substitute a values based procurement system for a neoliberal approach, which has allowed low cost to masquerade as best value. And that's the kind of conundrum that I try to expose in the book. And that's largely at an international level, taking examples from the US, from Sweden, and the United Kingdom. Moving quickly on to part two, which is the empirical heart of the book, the empirical guts of the book, are three deep dives. We sometimes think of the public sector as a single homogenous mass, but in institutional, political, social, and cultural terms, each public sector institution has its own nuances, and it needs to be addressed in and for itself. In the case of schools, running through these very quickly, and we can have time to discuss later, I hope. In the case of schools, I examine two things. First of all, the rise of the whole school approach to school food provisioning, by which I mean trying to align the pedagogy of the classroom with the food provenance of the dining room. That to get real alignment between the classroom and the dining room lies at the heart of the whole school approach. And then I go on to address two uh, major trends, as I argue, in the school food movement, both in the UK, the US, and as we'll see later, globally. And these are the trend to universality of free school meals, work in progress, obviously, and the rise of more plant based menus. In terms of universality, we'll see that this is very much a lottery because it's so uneven around the world. And I take as one of my exemplars the city of Malmö in southern Sweden, which is one of the finest school meal systems that I have found in reconnecting with this work, where they are a strong city inside a strong national system of free school meals nationally paid for out of general taxation. And that is the kind of the holy grail, if you will, of the school food movement in the United Kingdom today. And then I look at the rise of the rise of the plant-based menu, uh, which is highly contested, as you can imagine, in all countries. But I worked with organizations like ProVeg, uh, which argues that more plant-based menus, it's not anti-meat, but it's more 50-50 to deliver a triple dividend of meals that are cheaper, healthier, and more climate friendly. And as ProVeg says, what's not to like? So that's the school food chapter. Moving to healthcare, I try to show in both the United States and in the United Kingdom that nutrition, the status of nutrition, is such that it's the true Cinderella of the healthcare system. And the struggle, the quest for good food is largely a quest to try to give parity of esteem to nutrition and medicine. Some people argue food is medicine, of course, and we can argue about that. But the core argument in this chapter is that hospitals are being set up to fail in fast food nations like the US and the UK because they're trying to provide clinical solutions to what are essentially societal problems of ultra processed food. And frankly, I can't think of a better analogy for this than the labor of Sisyphus. As you'll remember from your Greek mythology, poor old Sisyphus was condemned for eternity to push up a boulder up a hill, only to see it roll down every day, every time. And it became a metaphor for futility, futile, never ending labor. And that's what we're facing in our hospitals by trying to provide a clinical solution to what is essentially a societal challenge. And in the book, I argue that we need a double revolution, one in healthcare and one in food culture. And I give examples of organizations which are already doing this. And finally, very quickly, I look at prisons, which are often the most neglected public institution in all our countries for a whole bunch of reasons. And I try to do two things in this chapter. I try to examine the defects of the carceral diet and its discontents. And at the heart of those stories, I take the US and the UK carceral systems because these systems are quite unique in the global north because they are the highest forms of mass incarcerations that we know in OECD countries. And in both countries, the US and the UK, I try to explore, I use the prism of two of the most famous nutritional controversies in each country. In the UK, I look at the nutritional supplement debate, where a nutritional supplementation program was introduced to the most violent institution in the country. It's called the Aylesbury Young Offenders Institution. And what happened was to cut a long story short, was that violent behavior plummeted when these young guys were treated to some decent nutrition. The sad part of the story is that successive governments never thought that these prisoners deserved any better and never carried through and followed up on the program. In the US, I shift the lens to what many of you guys will know, but it was a novel encounter for me. And I was shocked to find the debate around what you call Nutriloaf. You know, Nutriloaf. I mean, for those of you who don't know, Nutriloaf is a gross food concoction of multiple forms of food, all lumped together, which allegedly meets nutritional guidelines, and it is served to prisoners as punishment, uh, as if it was entirely out of the pages of Michel Foucault's Discipline and Punish. In the sense, I'd never encountered food that was used so consciously as a form of punishment. And then I look at the chinks of light in the US and the UK. And in the UK, I look at the Clink system. The Clink charity is a charity which uses food service to rehabilitate prisoners and to bring hope and dignity to allow them to rehabilitate themselves, because it teaches credentialized skills in catering, in cooking, and they help prisoners to find gainful employment and to stop reoffending. Anyway, those are the kind of empirical stories around which I try to craft a larger narrative. And very quickly, moving on, I then look at the rise of the good food movement, as I call it, in the US and the UK, which largely consists of civil society organizations working in concert with public bodies like municipalities or health boards to create a more sustainable food system. I won't mention these questions now because I'm going to return to them at the end. But in the US case, for example, I can't possibly do justice to your food movement in a single chapter. And therefore, I look at three vignettes of the food, three expressions of the food system, which seem to me to be most consequential. I look at the rise and the scope and limits of your food policy councils, 70% of which are local institutions, of course, as you know. I look at the case of New York City as a pioneering city in terms of developing an urban food policy, and I look at its victories as well as some of its big defeats as well. And then thirdly, I look at a more network approach at some of your key and very innovative programs, to my mind anyway. I take the Good Food Purchasing Program. I look at Healthcare Without Harm. I look at Anchors in Alliance, to look at how do you get a more federal policy and civil society force to begin to reform the federal public food system. So that's what I try to do in the good food movement. And of course, invariably, whenever I've presented this chapter, the first hour tends to get taken up by what constitutes good food and how on earth can you call it a movement when it's so incredibly fractured and fissured in terms of single issue food politics? Well, I address that in the book, and I'm happy to address it here again today. Because I'm running out of time, I'm going to speak faster and move on. These are two examples that I use in the book for two civil society organizations in the UK that have punched above their weight. The Soil Association for its Food for Life program, and Sustain for its strategies on London. And I give a big example of Sustain because Sustain shows the value of putting hitherto unknown information in the public domain about the quality of a municipality's food. And that has led to a ripple effect and a race to the top, because that information had a ripple effect in the sense that it raised awareness, it galvanized action, and it catalyzed change. And it's a lesson that we can all learn from, it seems to me. This is the Good Food Lottery in the UK. It's from the Food Foundation report, The Superpowers of Free School Meals. To cut a long story short, Scotland, Wales, and London have pioneered the rise of universal free school meals for all primary children. And England, on this occasion, is a food system laggard. And we are trying to persuade the English government to follow suit so that all children in the UK in primary school have access to a stigma-free universal free school meal, which we can discuss in a moment. And finally, I'm a member of the School Meals Coalition, UN sponsored but country led. It's a new generation of multilateralism to try to ensure that every child in the world gets access to a free meal at school by 2030. And one of the merits of this coalition is that it focuses on the implementation challenges and the strengthening of the evidence base to create robust evidence as to why school meals, sustainable school meals, delivers a multiple dividend. And these are the questions that I identified that emerged from my understanding of the the good food movement in the US and the UK. You know, how do we embed good food policies so they don't end when people who are forces of nature retire or die or move on? How do we embed them organizationally? How do we finance the good food movement so it's more sustainable? And how do we scale or replicate local innovations so that they become the norm nationally and not the exception? Thanks very much for your attention.
Great. Thank you, Kevin. I want to, at this point, move over into our discussion section. And I want to start by exploring some of the questions that you just mentioned, the three. And I want to first ask Nancy, in terms of embedding good food policies in public institutions, what are your thoughts about some of the strategies and approaches that could be used to make that a reality?
Thanks, Craig. I thought it might be helpful for those on the call just to get a little background on Healthcare Without Harm in case they're not familiar. So just very briefly, Healthcare Without Harm is a global organization. We have a network. We were founded about 25 years ago. We have a network of hospitals and healthcare systems that we work with to implore our mission to transform healthcare worldwide so that it reduces its environmental footprint, becomes a community anchor for sustainability, and really a leader in global movements for environmental health and justice. And we do this through conducting research and modeling strategic interventions to provide guidance and resources to spread and accelerate best practices in the field. We focus on different programs, including climate and health, safer chemicals, and of course, healthy food, which we're talking about today. And globally, we have about 70,000 hospitals in our network. And in the US, we have a membership program of 17,000 hospitals and healthcare systems. So we work with a lot of different folks across the globe, and some of to answer your question around how do you embed some of these policies and practices, it's hard. It's really hard. And I'm sure Chloe can speak to this as well. And many on our call today that are listening. We work in different areas across the US. I'll speak specifically on looking at what's happening in specific regions. So we have a couple different programs that we've employed over the years, one of which is Anchors in Resilient Communities, which has really created an anchor table of different stakeholders, both community partners, individuals from the community, also community-based organizations, municipalities, and hospitals, of course. And it takes really often a hospital champion to come to the table and really kind of promote what is needed in that community. We have a great example in California, in the Bay Area, of this working really well, the Anchors and Resilient Communities, where we worked with Kaiser Permanente and other partners on really embedding local food into the menus there and into the food supply chains. And then more recently, we've been working with the Center for Good Food Purchasing, as well as Real Food Generation, to create the Anchors in Action Alliance, which is what Kevin just referred to, and creating food purchasing standards for all sectors and sort of all institutions across the frame. So I will stop there and get into that more a little bit later through the other questions.
Thank you. And Chloë, do you have any thoughts about what sort of approaches could be used to more deeply embed these sorts of practices into the food system?
Yeah, sure. And I'll just say as well, from Friends of the Earth's perspective, our mission is to fight for a more just and healthy world. And we've been leveraging procurement as a tool to fight for a more healthy, fair, and sustainable food system for about the last 8 years. And I would point to, like, if we are putting together kind of a recipe for success in embedding these policies into institutions, I would point to 3 main factors that I think you need. And one is political leadership. I think that having a formal top-down policy that has politicians who are willing to talk about this, willing to message it, like we've seen Eric Adams do in New York City, comes from the very top down and then is integrated throughout the rest of the government. But this could also be, a state legislator, a city council person, but somebody who really has political leadership to set the agenda for the jurisdiction that they're helping to lead, to indicate that this is a priority of that jurisdiction. And then you also need a champion at the implementation level. I have campaigned in where I live locally to get our school district to embrace values-aligned purchasing. We had the political leadership part. We had a school board pass an incredible resolution, one of the most progressive climate action plans in the country for a school system that included good food purchasing and measures around, adding plant-based options and more local foods, embracing the good food purchasing program to that climate action plan. But despite that political leadership, at the implementation level, there just wasn't buy-in. And I've never been successful in kind of convincing a food service director, a procurement specialist, the folks who are doing the day-to-day work on the ground, that this is something that they should do if they're not motivated to do it and they don't see their job as being inclusive of, the broader food systems transformation goals that we seek, as opposed to some of the more traditional views of these jobs, which have been created again by the systems through which, like, our school meal system has emerged, which is basically just around balancing the budget and meeting the regulations. But having that internal champion that sees the potential to leverage their food service program to create these ripple effects throughout the food system. And I think a really important way of getting these champions is to have a dedicated staff person that comes with these policies. So when you're leveraging that political leadership to pass a policy, making sure that there's funding for implementation that can provide ongoing support and be kind of that anchor person within government. Because maybe that way, if you're hiring a person specifically for that job, they can be enthusiastic and have buy-in. And maybe there's people in different parts of the government that have a role, frontline food service staff, for example, or a procurement office, that may not see that buy-in initially. But if there's someone from within their own organization that is charged with implementing that, they can really help create buy-in internally in a way that folks like Nancy and I as external stakeholders often aren't able to do. And then I think the last factor for success is in embedding these good food policies at the institutional level is to have the community support and buy-in. And often that entails technical assistance like that Nancy's organization provides to hospitals, that organizations like mine provide to schools, and so many others that are providing this technical assistance, supporting with peer-to-peer collaboration across institutions that are facing the same challenges and looking for some of the same solutions to overcome them, and to ensure longevity of that policy, right? Because, political leadership will turn over, the staff who are implementing these policies will turn over. the community has to be there through all of the transitions to ensure that good food purchasing remains a priority for the jurisdiction, and that there's really a movement around it, both to create that political support, but also on the technical side to support implementation.
Great. Thank you. And I want to take a moment to mention to the listeners that if you want to ask a question, please put it in the chat. Soon we'll be moving over to questions from the audience. And if you have anything you want to ask either to the entire group or directly to an individual speaker, again, please put it in the chat. Kevin, I'm wondering, based on all of the research that you've done, are there examples that stand out in terms of what would be a way forward for putting this sort of approach on a more stable footing?
Thanks, Craig. What I've tried to do in the book, having set out the problems of the conventional food systems, I've tried to end each chapter by looking at what I call these chinks of light, social innovators that are doing something sustainable despite the system rather than because of it, and then try to look at the lessons from that. So I've identified organizations, for example, in the National Health Service, in prisons, in municipalities for school meals, all of whom have done something extraordinary given the given the inauspicious climates in which they worked. And usually it comes back to things that Nancy and Chloë have said about having some real sense of innovation, someone who is capable of going beyond the day job, as it were, what we call a force of nature. But the problem is the innovation tends to die with a person. It tends to stop. And every time, for example, in the health service, which is, the NHS is the biggest employer in Europe. It's an enormous, unwieldy bureaucracy. So whenever innovations have occurred, it's because a local health trust has worked in concert with a civil society organization like Sustain or like the Soil Association. And that outside link has enabled the NHS to engage with novelty. And novelty is something that big bureaucracies are almost hardwired to be resistant to, because they've got their kind of habits, inertia, routines, and so on and so forth. So doing something new requires what I think Chloë who mentioned, having some kind of dedicated officer who's completely dedicated to that task of not just designing novelty, but being there to help implement it in practice to embed it locally. But in each case, Craig, the story has a sad ending, as it were, because the organization itself doesn't maintain this social innovation, and nor is it replicated elsewhere in terms of it being rolled out or mainstreamed, as we used to say. So it becomes the national norm rather than a local exception.
And in terms of secure financial footing, what do you think is needed? Is there more evidence, more research, higher taxation? What is the solution here in terms of making sure these sorts of efforts are funded consistently and in an enduring way?
Yeah, it's an old academic myth, I think, to think that more research is needed, more evidence is needed. I mean, the jury is in. The evidence is in that good food policies are consequential, particularly for poor communities, poor, deprived, underserved communities. All that evidence is in, Craig. You know it as well as any of us. The point is, how do we get institutions to act on it, take it seriously, and to engage with novelty, if you will. One example I give in the book, one of our very best local food organizations based in Brighton in England. Brighton is just south of London. Brighton was the first local food partnership. Well, they don't call themselves a food policy council, but in effect, for a North American audience, they would be a food policy council, the Brighton and Hove Food Partnership. They were the first organization in the UK to win a gold award from the Sustainable Food Places Network for their, for their contribution to the cause of sustainable local food systems. And one of the novelties that they engaged in, and that we were all envious of in the rest of the country, was that they did a contract deal with the National Health Service because they felt that a contract was more consequential than a one-off grant. And they delivered health services to, quote, hard to reach populations in poor areas, and they earned a revenue stream as a result of this work. The NHS itself couldn't get into these communities. They didn't have the trust that this organization had because it worked with them day in, day out. And therefore they used that trust and they leveraged it. An intangible resource got leveraged into a tangible revenue stream. And I think we should think more generally, Craig, about that. And I'd love to hear what people on the call feel about that, whether it's feasible more generally.
Yeah, I'm wondering too, in terms of financial stability and, by extension, overall stability. Chloe, do you have any thoughts about what would put these sorts of efforts on more stable ground?
Yeah, I have two thoughts. I mean, one is that I think that for a lot of institutions, making an upfront investment in two things, scratch cooking and staff training, can be really important facilitators to make these programs financially stable long term in terms of food costs and implementation. So an example of this is Oakland Unified School District, where Friends of the Earth did a case study years ago. They had the ability to do scratch cooking, and they had a USDA grant that supported staff level training. And because of that, they were able to utilize whole plant-based foods, which generally are less expensive than the animal-based alternatives that they were partially replacing. Again, not talking about fully plant-based menus, as Kevin said, just more parity in terms of the plant-based and animal-based options offered. So they were able to reduce animal products on their menu, which generated cost savings that they then could invest in more local food. They had local meat that they purchased, local and organic produce. Student meal satisfaction went up. And even after making those investments, they were able to save $42,000 a year. But those cost savings were only possible because they had this ability to do that scratch cooking, and they had staff who were trained to make these options, tasty and affordable long term. So I do think that making those investments up front is smart, which leads me to kind of the overarching problem, I think, around the financial footing of these programs, which I call the wrong pocket problem, which is that governments have to pull money out of one pocket to pay for like a staff person to implement these things, to pay for kitchen equipment, to pay for the staff training that we just talked about. And the money that they're going to save down the line, first of all, it's in the future. Some of it may not be for 10 years in the future, and it's going to be hard to attribute to that specific program. It may be in terms of healthcare costs that are being saved. But those cost savings, those are going to into a different pocket of the government. And the way that so many government budgets are set up is that they are not incentivized to look at these issues holistically or long term. And if they were, they would see that these investments are worthwhile. And an example that I'm struggling with right now is in a state that I've been working with to try to implement climate-friendly food purchasing. And this state, like so many other US states and localities right now, is facing a major budget deficit. And so they are unwilling, unable to, add a new staff position to the budget, even though the state acknowledges, we agree with you that this could be a cost-saving strategy long-term. And I think that this is a really hard problem. I'd say this is maybe the hardest problem in my work, is kind of making that economic case for these upfront investments to get these longer-term benefits to society. And I think that there are starting to be, especially on the academic side, some thought into this concept of true cost accounting. How might we consider upfront the long-term costs of certain policy investments. And I think a good example of this is looking at the social cost of carbon. We accept now more in the climate policy realm that, okay, yes, this investment in renewable energy is going to cost us some money right now, but the social cost of carbon is so high that if we didn't do this, we would end up paying a much greater amount in the future. And kind of incorporating that into, at the federal level, the Office of Management and Budget, when they are evaluating how certain regulations will be borne out from an economic standpoint, they will consider these sorts of things like, okay, but what is the cost of not doing this? And so thinking about applying some of these concepts in food, including just straightforwardly the social cost of carbon as well, right? Because there's a social cost of carbon to the food purchasing decisions we make. But I think that is a ways away, that concept of kind of true cost accounting or implementing something like the social cost of carbon when it comes to food purchasing decisions is a ways away from being kind of practically implemented by state and local governments right now.
And Nancy, both Chloë and Kevin talked about some local innovations that they've been witness to. I'm wondering, what are your thoughts about how those sorts of local innovations can be replicated or scaled up to become the norm and not just the exception?
Yeah, and I will answer your question, but just to comment on sort of the conversation so far, I think I agree with everything Chloë said, and we're talking about values-based purchasing and what are our values at the end of the day. And we're assuming the values, or we've identified values in the good food movement, but we're now convincing institutions to hold those values. And I do think it's an interesting political time in our country, as we all know. And I think we're all sort of in crisis around what values we hold as Americans, and then how do we uplift those values. So I think it's bigger than just sort of like rethinking a financial model. It's more of like rethinking how we relate to each other, what our values are, what we deem as important. And food is a big piece of that. We're not immune to that in the food movement. To answer your question around innovations and sort of how to scale models, this is our bread and butter at Healthcare Without Harm. So we have a membership arm, Practice Green Health, where our goal is always to pilot a project and then scale it across our healthcare membership. So we really look at place-based initiatives right now around what is happening on the ground in certain locations. New York City being one of them, and New York State with the Good Food Movement, and the Good Food Coalition that has done a lot of great work with Good Food Buffalo Coalition as well. I know the governor sort of vetoed that bill, so they've gotten sort of missed a step here, but I know there's still a lot of momentum and a lot of great things happening. But I think it's really looking at a community, or like we work with hospitals to look at the communities that they're situated in, to then invest in the communities that they're in. So really identifying what the issue is. Is it local purchasing? Is it lowering greenhouse gas emissions? Whatever that issue may come up, and then working with the partners to leverage the network, the power to address that issue. And then really identifying what works and what doesn't work, and catering to that community that it's in. So when we identify an opportunity that is working well, let's say in New York, we want to bring it to another place, but we also want to be thoughtful in the stakeholders that are in other parts of the country. So really tailoring with that partnership to address the issues that are facing in that community. It's so case by case as well. But I think having a great framework to start, and that's what we set out to do in our Anchors in Action Alliance. So we co-created standards to align across sectors of all institutions. We have our Healthy Food and Healthcare Standard, where it's a guideline for hospitals on how to purchase healthy food and purchase in a values-based aligned way. And then we also have an action plan for them as well. So really looking at mapping out the steps that are needed, identifying that champion person maybe, and then building the coalition both internally within the hospital and then externally outside of the hospital, and them all working together to implement those practices. And that is really the framework that can ideally get us to scale that model and purchase more healthy food.
Okay, thank you. And shifting gears a little bit, Kevin, you point out in your book that the good food movement is essentially a movement of movements encompassing various interconnected agendas. How can these diverse groups, often with competing priorities, effectively coalesce around shared goals and strategies?
With great difficulty, Craig.
Hmm.
That's, I guess, the short answer. But I've probably spent more time debating, arguing this question, as I said at the outset, where groups, particularly with academic groups, but also food movement groups, when I've discussed it in different cities, about how you can refer to this incredibly diverse movements around the world, in the US, in the UK, as the good food movement. In part, it's a thought experiment where I say, just imagine for a moment all the food groups that we know around the world, or all single issue groups: local, organic, fair trade, animal welfare, labor rights, so on and so forth. You imagine that those groups also signed up to something of a common jurisdiction, like the good food movement. It would probably be the largest and fastest growing social movement in the world. And we haven't been able to see that because of they've fractured into single issue food politics. And I'm just suggesting that to us all, that there's something to be gained if we see ourselves part of a larger whole, where in addition to our single issue, we also sign up to something larger than ourselves. And that's why a network of networks, a movement of movements, many food campaigners have spoken to me in these terms. They see themselves, maybe take the Soil Association, for example. 25 years ago, they wouldn't talk to anyone who couldn't sign up to the organic standards. And yet what transformed their politics, in my view, was when they discovered the Food for Life school food policy, and that got them involved with new alliances to do with local social justice issues, public health issues, and suddenly they saw themselves as part of a wider movement. And I see, by the way, I see in the chat, Craig, that Janet Poppendiek, and hi again, Janet. Good to hear from you. Who says, what are the shining examples of these movements? And I have to say, Craig, a very sad story, that on my very first page of the book, I extol one of these examples of the whole school approach in the town of Oldham. And if you haven't heard of Oldham, it's a post-industrial town in Greater Manchester. And why it appealed to me is because it won a gold award when it was dubbed the poorest town in England. And it showed to me that poverty per se doesn't stop a municipality being highly innovative in terms of school food policy. And the secret, and I got to know the team there, and the secret, as it were, of their success was that they had a first-class catering team, going back to Chloe's point about scratch cooking, and a highly trained, motivated catering team, behind whom was a committed local political class who were committed to having their backs. And then they worked with local suppliers to strike good deals. They weren't paying more than the average for the region. Anyway, I extol Oldham on the very first page of the book, and then learn 4 weeks ago they decided to close the service because they were caught in this unsustainable grip of food price inflation on the one hand and declining school numbers on the other. And they've shut up shop, and they're going to hand over the service to the schools. So in answer to Janet's question, we can identify these shining examples, Janet, and how they attain this standard, but for some reason, they can't retain it unless they're someone like Malmö in Sweden, who are part of a national system which enables them to sustain it. Sorry, that's a rather long-winded answer, Craig, but I've tried to cover a couple of questions there.
No, that was very helpful and illuminating. And I'm wondering, Chloe, in terms of aligned agendas, goals in an otherwise very disparate group of food system investors, I'm wondering, what are your thoughts about how you navigate, competing interests, aligned interests, all in the service of trying to make this good food environment more robust and sustainable?
Well, like Kevin, this is something I think a lot about, struggle with on a personal level, and have a lot of, lively debates with my colleagues around. And I tend to fall on the side that I think that Kevin does as well, that we're stronger together, and that if we have a united food movement where we're bringing together the interests of so many different food system stakeholders to advance this kind of multi-value theory of how the food system can work. We're uniting workers and animal welfare advocates and folks who care about nutrition and public health, that combining our power, we're stronger together. I also think that on a practical and implementation level, for so many institutions, doing all of those things at once is so hard. And even when institutions are agreeing to do that, we're often seeing them make a lot more progress on the values that are a little bit easier, and namely local. We just have a lot more precedent of working on local food procurement here in the US. The other kind of value categories are maybe a decade or a decade and a half behind local. They don't enjoy the same level of political popularity that they do. And they would not have been able to be kind of inserted into some of these food system policies if it weren't for the fact that they were able to kind of ride on the coattails of some of the more politically popular values. It's really hard to just push an animal welfare specific or a worker specific policy when it comes to food procurement. But there are opportunities to do that. And I am someone who thinks we should be looking for those places to act opportunistically to move certain values forward if there's the opportunity. So I'll give you an example. Right now in the US, obviously, we have a lot of attention right now that is being paid to food and health. And it's because of energy that's on the right, this Make America Healthy Again movement, which consists of a lot of people who are concerned for very good reasons about the health and safety of their food supply and for their kids. And so one of the issues that may have some legs right now is organic and reducing pesticides in our food system. And the motivation of the folks behind this MAHA movement, you don't really hear them talking about the workers and worker justice. However, if we do get a transition to more organic agriculture, that is going to have trickle-down benefits to workers because there will be less exposure to workers from having pesticides. So should we just say we're not going to, work on something that advances organic only because workers isn't part of the kind of narrative framework or the moral universe of some of the folks who are pushing that? I don't think so. I think that we have to look for opportunities to push all the values forward, and that may mean separating them out into some different vehicles in order to make progress, as long as a movement, we're not leaving any of those stakeholders behind. But this is very much still a live issue, something that the coalitions that I'm part of, and I know many people who are attending this call are part of, are having a lot of these lively conversations right now. How do we stay banded together, but not give up on progress, say at the federal level completely for the next 4 years? So I would welcome people's thoughts on this. I'm curious. I'm curious what Nancy thinks as well.
Yeah, Nancy, what are your thoughts on Chloe's remarks?
I mean, I 100% agree. And just, I could talk to Chloe for hours about this. Yeah, I mean, I think it's the same tactic of, like marker bills, right? Like just roll it in to get some knowledge around the topic. And if there is some sort of trickle-down effect, then it's a bigger win than it just being completely ignored. So I think in a moment, I too am sitting on coalition calls. I know these conversations are swirling, and not that I have any great ideas at the moment, but I think we're going to have to really think outside the box on this one. I think the way that we've been running things and sort of addressing how we approach these topics, I think it's just a whole new set of rules, and I'm not clear on what those new set of rules are yet. So, I think we're all just, at least, well, I'll speak for myself. I know with all the executive orders that have been coming out and all the new information just in the last week, I think we're processing a lot of what's happening, and we can only plan for so much. But I think that with this new administration and the whole MAHA movement, it could be used to our benefit more than we realize, to Chloe's points as well. And that's my hope.
I have lots of thoughts about all of this, but that's a separate conversation and a separate forum. I think we will take the time now to move on to audience questions. And one of the first that came through was from Francesca. And Francesca asks, who defines good food? How do we find ways in which the good food provided guarantees the right to food appropriate to individual and cultural needs? And anyone feel free to jump in and answer that.
Craig, shall I kick off, or
No, go ahead. I'm opening the floor.
As I said earlier, I think what constitutes good food is probably the question that I've got asked most of all about this little book, and I for once I anticipated that, and therefore I thought I'd better address it in the very first sentence on the very first page, so that people didn't think I was ducking the issue. And I've said, in many circles, good food is understood to be associated with fine dining, exclusive restaurants, celebrity chefs, and so on and so forth. But in the following pages, it's understood in very, very basic, simple terms as food that is appetizing, nutritious, culturally appropriate, and sustainably produced. That's I don't believe that's a fancy definition, Craig, and it's sufficiently generic to allow more granularity within that for different communities, because all our countries consist of multiple communities, and they have different values about food. So on the one hand, we have to strike a judicious balance, don't we, between on the one hand offering some viable definition of good food without being overly prescriptive as to what that food consists of. So we want people to have a sense of agency over their diets, because food is just too big a problem in our lives, in our societies, to allow it to be treated as a purely personal choice, which is one of the things, of course, that big food is part of the big food playbook that I expose in the book, where they say things like, in all our countries, they say similar things. There's no such thing as good or as bad food. There's only bad diets, i.e., consumers are to blame for putting the stuff together, not us, and so on and so forth. So I would say that would be my response to the good food question, Craig.
Yeah, I like that definition. I think we look at that word sustainably. I think if we look at that in the broader social context of economic, kind of ethically produced, beyond just pure environmental sustainability, I think that captures the kind of working definition that we have as well. And I just wanted to agree in support of your comment that one of the pieces of opposition, I think, that we face to this from a narrative perspective in the US is kind of this idea of nanny state, when it comes to the public plate and telling people what they're going to eat, and food is a personal choice and defending that. And that's what makes food politics like such a dangerous, we're doing all of this work on very thin ice because of that industry dominant narrative that food is a personal choice and you can't touch my plate. But Kevin, as you point out in the book, with your idea of the public plate, the government is making so many decisions when it comes to our food system. They are making so many decisions, what to subsidize, what not to subsidize, who gets free food, who doesn't get free food, what is going to be served to people in those sorts of institutions that you named, Kevin. Like carceral facilities, for example, they are making 100% of the choices. People who are incarcerated, they don't get which of these 3 entrees do you want? There is one meal every day. And so when we're talking about the good food movement, one of the things I think we really have to emphasize is that the government is already making choices for people about what ends up on our plates through their policies. And nowhere is that more clear than in the case of public food procurement, our children in schools, people incarcerated, public hospitals. And so what we're doing is asking them to make better choices that have these positive ripple effects from farm to fork. I think there's a way to frame this around responsible use of taxpayer dollars. That's something we're leaning into with more conservative policymakers, that this is taxpayer money that you've been entrusted with to use to make the most effective spending. And if you're spending on that on foods that are going to be environmentally destructive and cost taxpayer money down the line, on foods that are going to put people in hospitals later in their life, that is not effective or responsible spending of that public money.
Yeah, I think it's tricky. One of the, I think, major barriers with all of this is the idea of change at all. In New York, as you mentioned earlier, the Good Food Bill was not signed into law by the governor, and some of the opposition that we believe had an impact on it was really coming from corners that weren't necessarily against the principles of the bill and what it was supposed to do, but the idea of change possibly opening the door to unforeseen consequences. And I'm not sure, if there's enough evidence, both in models and in practice and in theory, that can alleviate the fear of change and, unexpected consequences. That's, I think, one of the biggest challenges that this sort of approach faces, is the fact that it's different at all, that it's going to change anything at all. It's either the status quo or nothing, So, Nancy, I'm curious what you think about this.
Yeah, I mean, through this conversation, what's coming up for me is why we even have to define good food. And I think, to Chloe's point, like, there's so many decisions being made that we don't see by our government, by big corporations, agribusinesses, that we just don't know about, like, as everyday people. And it just strikes me like we have to have this movement because of overprocessing, really, of food. There is a level of overprocessing that happens for cheap food, which then trickles down, that impedes all of the values that we've identified, for the benefit of the economy, right, per se, to really make more money in our capitalistic country. And then that's at the cost of health for individuals, for communities, in many ways, not just physically, but sort of all the ways, all the social determinants of health. And I think ultimately the way that Kevin defined good food is accurate. And it just strikes me that we even have to define what good food is, because I think if, we look back many, many years ago, I think I have a magnet that somebody got me that is like, my grandparents just called it food, not organic food, because it used to be better agricultural practices, more natural practices that were being practiced and implemented. And now we're really having to sort of read between the lines, fight different battles that really expend so much energy and resources that create barriers to get just healthy, fresh, basic, whole foods to communities that are culturally appropriate as well.
Yeah, I mean, a lot of that change really has been driven by the requirement for greater profits at scale and the usage of efficiencies that aren't necessarily concerned with, what we would define as good food, healthy food, but more in, yield and output and profitability, which is part of the backbone of how things work, particularly in the US. So it's something that, can't be ignored, but also it's something that runs up against this idea of values-based procurement. If you're throwing in anything other than the lowest possible cost, the highest possible yield, and the highest possible profit, then you're getting into controversial territory depending on who you're talking to. We have another question from Aura this time, and Aura says, NYC is currently facilitating a culinary training at DOC and ACS to upscale nutrition staff on how to prepare more plant-centered, seasonal, regionally sourced, culturally relevant meals, similar to the work done with NYC schools and hospitals. Both of these programs are incredibly effective and well received. However, it's more difficult to get the same level of buy-in from prison food reform. How can we shift the narrative around prison food as a tool for rehabilitation to get more buy-in and support to continue these sorts of programs? And DOC is the Department of Corrections, and ACS is Administration for Children's Services, for those of you who may not be New Yorkers or well-versed in New York administrative nomenclature. Kevin, I want to go to you. You talked a little bit about prison food. You explored prison food in your book. What are your thoughts with respect to getting more buy-in from prison food reform?
Yeah, well, I think we should start, Craig, by understanding what the barriers are and have been, and almost historically in both our countries, the US and the UK, there's been a principle at the heart of mainstream opinion. The principle, it's called less eligibility. And this principle has run through, particularly strong in the UK, which over 200 years, which has basically asserted, that the most basic level of provision in prisons should be lower than, or certainly not better than, the lowest level in outside society. Otherwise, it would create a perverse incentive that people would want to, poor laborers would want to break into prison to access better food. I mean, it's some level of absurdity, but and it's that principle of less eligibility that I found lay behind the failure of successive governments to act on the nutritional experiment at Aylesbury, what I call the Aylesbury mystery, the road not taken. And it's good for us to understand that prisoners are culturally perceived to be not deserving. If we think of a spectrum of users of public food provisioning, the most deserving, in quotes, would be perceived to be children, with maybe patients in the middle. And on the extreme other end of the spectrum would be prisoners, because they are deemed to be undeserving human beings, even though the prison sentence is the punishment, and the other part of prison, rehabilitation, should be equipping them to re-enter society, because the bulk of these guys, and in the UK, 96% of all prisoners are men, the vast majority of whom will re-enter society, and we want them to be fit. And even if you took a really super right-wing attitude to this, you'd have to say to yourself, well, don't we have a fiscal duty, as Chloë was saying earlier, to reduce their pressure on the public purse, to make sure that they're fairly fit, they can labor, and they're not a drag on public finances. But somehow that gets lost when mainstream media think about prisons and prisoners and their just desserts, it seems to me. That's what comes through my own analysis. Anyway, Craig.
Craig, could I add a little perspective on the carceral system as well?
Sure.
Yeah, I totally agree with what Kevin said. And I think it's just part of the reasons why change in this sector has been so intractable, I think is related to the fact that our carceral system, our policing system, are vestiges of chattel slavery in the US. And they were intended to be used as tools for punishment and not for rehabilitation. And so it is a huge ship that has been going in the same direction for a very long time to try to turn. And seeing food used as a tool of punishment in the carceral system is so common. And so to shift the narrative that food should be used for healing and not as harm and punishment in prisons is just really hard to do. And I think that this is a place where the cost is different. We do have to spend more on food in the carceral environment. We're spending a shockingly low amount on food in prisons in the US. And so again, making that investment, yes, you can make the case for long-term savings to the public purse. But I do think, to Nancy's point earlier, this is a broader narrative shift that we need in society around the value of our fellow citizens who are currently incarcerated, and really talking about the right that all humans should have to food that is culturally appropriate, that is safe, and that is nourishing for them. I think that's the duty in part of our movement, to make the case that everyone deserves that right.
On a related note, a comment from one of the audience members, Ira, reflects something that I think is a part of the carceral food environment that doesn't necessarily get talked about as much. And Ira says, more of a comment on this topic: I work closely with incarcerated pregnant people. The quantity and quality of nutrition in carceral facilities is horrific, but it's important to how much it ties to the public health issues, i.e. women's health. There have been some bills introduced in states calling for providing timely and regular nutritious food, prenatal vitamins, etc. They haven't moved from committee. However, it's so important to bring to light that this is an issue when we have these sorts of conversations. So a point to take note of. I want to go to the next question. And Chloe, I want to stay with you to start for this question. This is from Jesse. And Jesse asks, this panel is inspiring me to think about international thought partnership on good food purchasing. Other than this webinar, what examples can you share of international thought partnership that is already happening, and how has it moved the work forward?
Mm-hmm. Well, I work mostly domestically, and we do a lot of work on school food, but there are coalitions that we're part of to try to compare lessons learned across different country situations. And I found myself learning a lot just reading Kevin's book and some of the examples of jurisdictions around the country that have done more progressive work. There are alliances like the Milan Urban Food Policy Pact, for example, that includes cities from around the world that have done progressive things around food policy that bring some of those folks together to learn from each other. The C40 network does work around food policy and is trying to create collaboration between the cities working on it. So I do think these collaborations exist, and it's just about finding the ones that apply to the right countries and the right kind of subtopics. As Kevin pointed out, the procurement context for schools, for hospitals, personal environments. And then there's many others we haven't talked about too. There's the military service members, veterans, there's national parks, there's government employees. A lot of these have different contexts, but I am seeing more collaboration crop up in these spaces. And if folks want to get in touch with me, I'm happy to kind of point you to anywhere where I know that these collaborations might be happening for the types of jurisdictions and the types of public institutions that you're interested in.
Great. And Nancy, do you have any thoughts regarding international partnerships, collaborations on good food initiatives?
Yeah, I mean, within my purview of work, since we are a global organization, I've had opportunities to work with our global offices and look at what's happening in different countries across the globe and try to understand the stakeholders. I know that, so I'm happy to talk with anyone as well if there's opportunities there to reach out to some of our partners or connect you. I'm happy to do that. But there are more and more foundations I find that are talking about the global and international aspect of good food purchasing. I know Rockefeller has been one over the course of time that's been interested in this topic, and there have been others as well. So I think my hope is that as this gains momentum, both in the UK and the US, it'll just continue to grow across different nations around the world, and continue to gain momentum. But the sort of coalitions and pacts that came up, Chloe already mentioned, but if I think of any more, happy to send it through the network.
Thank you. And on a similar note, I'm directing this at you, Kevin. Stephen asks, how does the UN World Food lift up good food? And I would say, if at all.
How does the UN?
Mm-hmm.
Yeah. Well, in the past, I've been quite critical of some of the early UN efforts when they introduced a homegrown school feeding program, which I argue in the book um, showed that their preconceptions were part of the problem, because they thought getting locally produced food into the school food system instead of using American surplus food, which undermined local agricultural systems, of course, that system would be what they called a quick win, an easy victory, because they saw the school food system as a simplified system, and of course it undermined them, because they couldn't get a quick win, because it's far more complex than they thought. Having said all that, Craig, I'd say the most impressive part of the UN food system that I've personally been involved in was what I showed on my final slide, on my penultimate slide, about the School Meals Coalition. That there's well over 100 member countries now. I think it's the biggest global school food movement in anywhere, and it's really consequential in the sense that it's showing low and medium income countries how to do this and to make it sustainable in practice. And now they've turned their interest to Europe because Europe have felt that they didn't need any help to go sustainable, and they do, of course. Many countries, as I said about the story earlier about Oldham, Oldham is only one municipality among many, many others in England, not Scotland, Wales, and Ireland, but in England, where they're going down like dominoes. And they're all withdrawing from the school food market because they can't make it work economically, commercially. And my fear is, and I've said this to the municipal movements, I've said that I fear that school food in England could go the way of adult social care, where the municipal role disappears and dwindles to the point of oblivion, leaving it all to the likes of Campus and Sodexo and Aramark and the big corporates. That's my big fear about the future of the school food movement in places like England.
And on a similar note, Jan had a follow-up question and asks, any ideas for how to create a supply of skilled implementation champions? Is there a role for higher education, for example, the CUNY School of Public Health and similar institutions? And Kevin, I'll direct that at you to start.
Okay. The short answer, Craig, I think yes. There's a huge role for us to think about, going back to Chloe's point, about creating a more common social resource for enabling public institutions, particularly schools, to think about scratch cooking and raising the skill level of catering teams. I give a real example, Craig, in the book about Malmö. When Malmö decided to do this, to create a sustainable food system, they put the whole of the budget, almost 100% of the budget, into upskilling their kitchen staff, because they thought this would create an empowered workforce that would have the autonomy and the discretion to design better diet, better meals, and to reduce waste. And so it proved that that is a highly talented catering workforce. And then I brought some of those, what in the UK we call them school dinner ladies, school caterers, school lunch personnel, over to Bristol and over to Wales to talk to their peers, because that's how organizations learn. Just as firms learn best from other firms, public food professionals learn best from their peers in terms of peer-to-peer learning. And we should facilitate that at every point. And I'm sure Nancy and Chloe have their own examples of this.
I'd give a shout out to the work that the Chef Anne Foundation is doing right now on this with school food service professionals. And they have specific programs that are focused on building up the workforce for folks to be able to advance scratch cooking and using whole, healthy, culturally appropriate foods in schools, and recognizing that workforce development is a key piece of that. And of course, workforce development is something that governments invest in all the time. It's a way of investing in the growth of certain industries that are beneficial to that jurisdiction. And school food service, I think there's a very clear case for that. And we have seen some jurisdictions. California has made some investments in training for school kitchen personnel. And I think that's such a good investment to make. There's a role for government there, and there's a role for civil society organizations and technical assistance providers like Chef Anne to do that. And wow, Rosita is so on top of these links. Thank you.
Nancy, I'm curious, what are your thoughts about growing good food champions and the role that different institutions can play in that?
Yeah, I mean, I agree with everything that my colleagues said here. We piloted a program that unfortunately did not get too far off the ground a couple of years ago, closer to the beginning of the pandemic within hospitals, because there was such a high turnover rate, especially early on in the pandemic, of hospital workers across the whole systems, but especially in cafeterias. And we partnered with a chef that had an educational program to bring it into a couple hospitals in the Northeast to train and skill up. It was a kind of a combination of actually recently released individuals from prison, as well as individuals just coming into the field of wanting to become chefs. And within hospitals, it's not a hot job to work in a cafeteria. It's not the most alluring if you're a chef, but it has great pay, it's very stable, there's benefits, etc. So we really tried to couch it in a way that was accessible for people to join the program and then really benefit them to learn and upskill in the program. And unfortunately, there just wasn't enough support administratively within the hospitals to really get it up and off the ground. And that kind of goes back to the first question of how are we embedding policies and practices of good food? And I think, we've said it so many times here, it really takes that champion, but ultimately someone in a position of power to champion takes things a lot further than just, any employee in a hospital. So we've seen so many times if like the CEO or president of a hospital supports good food or supports a specific program, then typically it's easier for the entire staff to operate in that way and purchase their foods in that values aligned way.
And I think in the interest of time, I want to take this opportunity to give you all a chance to leave any parting thoughts. And since we're already with you, Nancy, if you have any, final ideas, thoughts, comments you want to share to the audience, go ahead.
Sure. First of all, thank you. It's been a pleasure speaking and being here with everyone. And Kevin, I'm so excited to have a hard copy of your book in my hands soon. Yeah, and I think, to the power of collaboration, I think those are my final words. I think there's power in numbers, there's power in coming together, and I think really aligning those values amongst the communities and groups that we're in will then help sort of reach our goals, whether it's good food or other areas of what we're fighting on, but continuing to fight that good fight.
Chloe?
Yeah, thank you so much for having me. This has been a really great conversation to be a part of. And I too am looking forward to getting to read the rest of the book in a printed copy. Yeah, I plus one what Nancy said. And, you know, even though I think these successful policies do entail a lot of collaboration and a lot of moving pieces to work, I also wouldn't want to lose sight of the fact that a lot of them start with one passionate person who's like, let's do this in this jurisdiction at this institution. And that can be, you know, a parent of a student trying to make changes to that school meal program. It can be an employee making changes to the cafeteria that they eat out of. Obviously, it could be a staff person of a city council member that hears about the good food purchasing program and wants to get that done in their city. Like a lot of times we've seen these policies originate from one person with a vision. And so if all of the people on this call kind of go back to the institutions, public institutions where they have some influence, I think this is one answer to how we can grow and scale these interventions over time.
Great. And last but not least, Kevin.
Well, Craig, I wanted to thank you and Rositza and the CUNY team for hosting us and for connecting me with Nancy and Chloe, who I've really enjoyed getting to know, and I hope to continue the dialogue. In terms of a wider point, I think because we all come from different places on the call, the most general point I would make is this: it's so important to identify good practice, whether we're looking at schools, prisons, or hospitals, or whatever, because that changes the entire conversation in our campaigns, because it means, you know, we can say it can be done because it has been done. And the question becomes not whether it's possible, but it's happening there. Why isn't it happening here? And then we can begin to identify a theory of change and develop policies and mobilize each other, collaborate with each other, as Nancy says, to make all our actions much more consequential. Thanks, Craig.
And thank you to all of our panelists for such a great discussion. Before we close here, I want to plug one more time our next event, which is Book Talk, another book talk, The Painful Truth About Hunger in America. That will be on March 27th at 10:30, from 10:30 to 12. We'll be sending out another calendar invite and notification around that to everyone who's subscribed to our mailing list, which is over 6,000 of you. Hopefully, if you found this interesting, you'll subscribe and attend more events. And then in May, we have our Grand Rounds lecture with Dr. Omni Cassidy, and that's May 1st at 4 p.m. Again, thank you so much to our panelists and to our audience members. Great discussion, and hopefully this is the beginning of the next wave of the good food procurement movement. Thank you.
Thanks so much for having us.
Thank you.
Bye. Bye.
Bye, everyone.
Take care.